Hello, my name is Dr. Miriam Purnell, and I'm a pharmacist. If you are considering a career in science, technology, engineering, and math, I'd like to tell you why pharmacy might be a great career choice for you. The practice of pharmacy includes components of science, technology, engineering, and math, but most importantly, being a pharmacist allows you to improve the health of people right in your very own community. Over the next few minutes, I'll be discussing more about the career of pharmacy and why it is a prescription for a rewarding career. Today, I'd like to talk a little bit more about pharmacy and why it is a prescription for a rewarding career. Again, my name is Dr. Miriam Purnell. I am an associate professor and department chair at the University of Maryland Eastern Shore School of Pharmacy in the Department of Pharmacy Practice and Administration. I'm an academic pharmacist. What is pharmacy? Pharmacy is the branch of health sciences that deals with the preparation, dispensing, and proper use of drugs. Pharmacists play an important role in 5 areas. The first is drug delivery and medication safety. This means that pharmacists are responsible for making sure that the medication gets to the patient and that they are able to take it safely. Another important part of the role of the pharmacist is patient education and advocacy. Pharmacists are integral in educating patients about their medications. They can help answer questions such as, what do I do if I miss a dose? What side effects can I expect? And how long before I see results from my medications? Pharmacists are also involved in monitoring drug therapy, so they can talk to patients and see if the drug is working appropriately and make recommendations for changes to their physicians if necessary. Pharmacists, as I mentioned, can make recommendations to physicians and other healthcare professionals. They are integral parts of the healthcare professional teams that help to make patients better. Pharmacists can also play a role in research and clinical studies. In order for someone to become a pharmacist, you must attend professional pharmacy school. So professional pharmacy programs are generally 4 to 6 years. However, there are some programs that are accelerated and allow you to complete your pharmacy education in 3 years. The Doctor of Pharmacy degree, or PharmD, is the entry-level degree earned by pharmacy graduates. Generally, college courses are required before starting pharmacy school. You usually have to take courses such as biology, chemistry, physics, biochemistry, anatomy and physiology, mathematics, such as calculus, statistics, and other courses before you can enter pharmacy school. The role of the pharmacist has evolved over the years. Traditionally, pharmacists were involved in preparing or compounding medications and dispensing or giving them out to patients. The profession has continued to evolve, and now pharmacists are very much more involved in patient-oriented or disease-oriented roles. So they play a role in helping to prevent disease, eliminating or reducing symptoms, and they do this in conjunction with other healthcare professionals to promote safe and effective use of medications. Indeed, the role of the pharmacist has continued to expand. Pharmacists now play a great role in preventing and eliminating disease through the giving of immunizations. All 50 states allow pharmacists to provide immunizations. In fact, 25% of flu shots given each year are administered by pharmacists. Pharmacists can also play a role in smoking cessation. This means that they can discuss therapies and other strategies that can help patients to quit smoking. Some pharmacists can work under what is called a collaborative drug therapy management protocol. In this team approach to healthcare delivery, a pharmacist and a physician work together to provide care for the same patients. The pharmacist and physician establish written guidelines or protocols that authorize the pharmacist to engage in a number of patient care activities, including ordering lab tests, starting, stopping, or changing medications. You may be wondering, where do pharmacists work? Pharmacists work in a number of settings, including in your community. You may have seen a pharmacist working at a Rite Aid and giving a flu shot. But did you know pharmacists can also work at universities, such as I do? They can also work in hospitals, government agencies, long-term care facilities, such as nursing homes. They can provide care to patients who live on Indian reservations. They can work for pharmaceutical companies, inpatient and outpatient clinics, as well as insurance companies. You may be wondering what types of pharmacy specialties exist. Just like physicians, pharmacists can specialize in a number of different areas. Some pharmacists choose to be compounding pharmacists. Their primary role is to compound or make medications to be dispensed to patients. Some pharmacists are diabetes educators. Their primary role is to educate patients about their disease, diabetes, and to help identify appropriate drug therapies to manage their diabetes. Other pharmacists might choose to be oncology pharmacists, which means that they work with patients who have cancer. Other pharmacists may choose to be pediatric pharmacists, where they help to care for sick children in hospital settings and outpatient settings. Some pharmacists may also choose to work as psychiatric pharmacists, which means that they help patients who have mental illnesses to use their medication optimally. So this includes patients who might have depression, bipolar disorder, or schizophrenia. Lastly, some pharmacists work in veterinary pharmacies. Their primary role is to dispense medications and ensure that they are safe for animals. Pharmacists are compensated well for the work that they do. In 2018, the median pay for pharmacists was approximately $126,000 a year, which equates to about $60 an hour. As mentioned previously, the entry-level education for pharmacists is the Doctor of Pharmacy or PharmD degree. As noted on this slide, the job outlook is good for pharmacists. Between 2016 and 2026, we expect that jobs for pharmacists will grow at a rate of about 6%, which is as fast as average. So why should you choose a career in pharmacy? There are 5 reasons why you should. Pharmacy is a well-rounded career. This means that you have the opportunity to use the knowledge that you've gained in science, technology, and math, and you also have the opportunity to use skills such as communication skills and interpersonal skills. Pharmacists are a vital part of the healthcare team. They work closely with other healthcare professionals to help patients get better. There are outstanding career opportunities in pharmacy. There are lots of different settings that pharmacists can practice in. There are excellent earning opportunities for pharmacists, and last but not least, pharmacists continue to be among the most trusted professionals in our country. So the question is, should you be a pharmacist? Well, if you like chemistry, biology, and math, if you like to help people, if you like to solve problems and puzzles, if you're dependable, organized, detail-oriented, and able to communicate well with others, then pharmacy might be the right career for you. You might also be wondering, how can you prepare for a career in pharmacy? As a middle schooler, I would encourage you to find a mentor, a science teacher, or perhaps a local pharmacist. You should consider meeting with your guidance counselor to ensure that you're taking the right courses, and you should gain experience in a pharmacy. Perhaps spend a day working in a pharmacy or volunteering in a pharmacy to see what it's like. When you're old enough to work, you can also consider getting a job in a pharmacy and working as a pharmacy technician. If you'd like to know if pharmacy really is the right career for you, I would encourage you to visit this website, pharmacyforme.org, for more information.